Global Brigades. Un aplauso para los niños, por favor.
Música del futuro. Una vaina loca que me lleva a la gloria. Nunca se...
On May 4th, 2012, Global Brigades celebrated our sustainable transition in the community of Zurzular in Honduras. The entire community came together to celebrate the completion of Brigades projects in Zurzular by performing traditional songs and dances, while the mayor of the local municipality distributed awards and local school children proudly wore their new Global Brigades t-shirts in honor of this special day. Since 2009, volunteers, local community members, Global Brigades staff, and technicians have worked together to bring health and development projects to over 600 members of this agriculturally based mountaintop community. Our sustainable transition in Zurzular represents the heart of our mission, to transition from infrastructural and brigades projects to providing a supportive role for community organizational development. By providing trainings, support, and empowerment, local community members are equipped with the necessary tools to maintain and perpetuate projects locally well into the future, while allowing Global Brigades to expand into new communities. In 2009, medical and dental brigades were the first programs to enter the community. To date, over 2,000 patients from the region have received consultations with doctors and dentists. Recently, the Medical Brigades team has finished training a group of community health workers, made up of local community members who will help monitor patients and provide basic health care in the locality on an ongoing basis. Based off of patient records and discussions with staff at the Community Health Center in Zurzular, we learned of the high incidence of diarrheal disease in the community and set out to complete a full-scale water system. In December 2009, Water Brigades completed Zurzular's community-wide water system, bringing clean and sufficient water to over 600 community members. Volunteers helped to dig 6,900 meters of trench and installed 6,900 meters of piping in order to connect 90 homes to the water system. Public Health Brigades first began working in Zurzular in 2010 and has benefited 87 families in the community. Prior to entering Zurzular, only one family in the community had all 4 public health projects in their home. We are proud to report 95% of the homes in the community now have water storage units, eco stoves, which replaced traditional stoves that did not have chimneys and contributed to respiratory disease due to the accumulation of smoke and soot in the home, latrines, and concrete floors. These infrastructural improvements are designed to improve sanitary conditions in the home in order to prevent the spread of common illnesses. Prior to microfinance brigades entering Zurzular, community members did not have access to capital. Through the work of brigades, we were able to create a community bank and a way for families to earn loans to grow their businesses, with loan repayments being circulated back into the community. Since microfinance brigades first began working in Zurzular in 2011, the average family income has increased by approximately 25%. Over the course of 11 months, 161 microfinance volunteers have contributed over $11,660 into the community bank to provide loans to community members to increase production and expand their businesses. With a generous donation from brigaders at DePaul University, we were able to break ground on Project Z in October 2010. This school will help bring needed educational infrastructure to a community that previously only had a one-classroom school to serve all the children in the community. At 4,000 square feet, Project Z features 3 classrooms, a library, community gathering space, and cafeteria. We are proud to report that Project Z opened its doors to students in June 2012 and is currently providing a quality space for learning to over 150 kids in the community. Global Brigades in-country staff and technicians will continue to provide follow-up and additional trainings to community members in Zurzular on a regular basis through monthly visits. Local community health workers will help monitor the health status of the community and are in regular contact with Global Brigades doctors should any health concerns arise. Zurzular's Basic Sanitation Committee will help to ensure that public health brigades projects are being maintained and properly used, while Zurzular's Water Council will monitor the water system, collect usage payments, and employ a local plumber to repair any problems with the system. Local board members of the Caja Rural, or Community Bank, help distribute loans and collect payments. Through this sustainable model, local community members are equipped to maintain the integrity of Brigades projects well into the future, while Global Brigades in-country staff are on hand to answer questions, provide follow-up, and additional trainings as needed. Thank you to the over 1,200 volunteers that have worked in Zurzular to make these projects a reality. Without you, none of this would have been possible. In addition to all of these projects that were implemented, all of the preparation, community mobilization, perpetuation, and follow-up is funded by student-led brigades. This year, we hope to exit from 2 more communities, and with the continued momentum and support from brigaders like you and our student-led chapters, we know we will achieve our mission at a faster and faster rate.
Ella me descontrola, donde estamos a solas, cuando yo siento eso es una vaina.